Hi, my name is Victoria Damelay, and I'll be talking about Marfan syndrome. So, Marfan syndrome, we're going to define the disorder, the causes, the symptoms, the diagnosis, treatment, and prognosis. We're using these pictures like how's the weather been? It's like, well, this tall person really doesn't like, making those jokes because they have a syndrome or a disorder. So, just think about when you make these jokes at people, whether they're really short or really tall, like maybe they have some sort of disorder. So Marfan syndrome is defined as a disorder that affects the connective tissue in many parts of the body. The severity of Marfan syndrome varies from one individual to another and progressively gets worse over time. So as you can see in this picture, they're showing the comparison between a normal person with a normal chest versus a person with Marfan syndrome. It has an indent in it. You see with somebody with hands, how it's longer than the other for Marfan syndrome. Their heart, how that's affected, and their lungs and everything else, the skeletal system. This syndrome is an issue because it's involving your connective tissue, which is the glue that holds your cells and organs together. It's vital for your growth and development. And yeah, it just affects your many different, body systems, such as your cardiovascular, your skeletal system. So the causes of Marfan syndrome is inherited. It is an autosomal dominant pattern. So basically, if one person in your family has that mutation, your child is more likely to have it. So it's like 1 in 2 chance of your child getting this disorder. And also, like, this disorder is due to mutation of the FBN1 gene that causes Marfan syndrome. And that's usually 25% of the cause of this disorder. And usually 1 in 5,000 people get this disorder. So with the FBN1 provides instruction to make a protein called fibrillin 1, which is talks to the microfibrils to provide strength and flexibility, which they control your growth and repair of tissue. So if there is a malfunction FBN1 gene, then you won't produce as much fibrillin 1 that'll go down, and your elasticity in tissue will go down, your growth will be uncontrolled, hence why people grow so tall and they don't have like that strength in the connective tissue or that flexibility as a normal person would. So here are the symptoms of Marfan syndrome. So you see that they usually have disproportionately long legs, arms and toes and fingers, extremely tall and slender build, long and narrow face, high arched neck and crowded teeth, indented or protruded sternum, dislocated lens of the eyes, high pressure in the eyes, cystic changes in the lungs, flexible joints, flat feet, and curved spine, abnormal heart sounds. This is why Marfan syndrome is such a problem yet again, because it affects different your connective tissue of the body. So it is diagnosed through detailed medical and family history and a complete physical examination. So you would either have an ECG, an echo, an eye examination, a CT, an MRI, a biological test, a genetics test to prove that you may have Marfan syndrome. It can be difficult to diagnose because many connective tissue disorders have similar signs and symptoms. The signs of a disorder greatly vary in both features and severity, and you must be certain with the combination of both the symptoms and your family history to confirm that. Sometimes information isn't enough to diagnose Marfan syndrome, and having one physical feature isn't enough to prove that you have Marfan syndrome. You have to have multiple symptoms of the disorder. So here are the treatment options. There is no cure, but treatment focuses on various complications of the disease. So as you can see here, you have checks regularly, check from different kinds of doctors to check, your heart, your skeletal system, everything else, making sure that's working properly. You take medications such as like blood pressure lowering drugs that can help you prevent the aorta from enlarging or risk of rupture. You can have therapy, which, when you have vision problems, because that does mess with your connective tissue in your eyes, you can get glasses or contacts. There's surgical procedures such as aortic repair, which you see here in this picture with the heart, and then scoliosis treatment, which you can see here in this x-ray where a person has scoliosis and they do like this, they set a bar to kind of make the back straight. You have breastbone correction, and you also have eye surgery and dental visits as well to correct your teeth because it does overcrowd. So life after the prognosis of Marfan syndrome. So you can live a long life through Marfan syndrome through regular monitoring and modern day treatment, but you should also avoid competitive sports or certain recreational activities that require you to sweat and have your heart rate up to for it to beat more. and that'll cause problems with your heart. And because that connective tissue isn't as strong as a person with a normal, connective tissue would have in their heart. So you would do less intensive sports, such as walking. You are very conscious of like your height, and that that could cause you to be really depressed, or have anxiety because you're taller than everybody else. So with the proper regular visits to the doctor and seeking counseling along with family support, you're able to not be as self-conscious about your disorder and to live a healthy and happy life while eating healthy foods. In conclusion, I was able to define, talk about the causes, the symptoms, the diagnosis, the treatment, and the prognosis of this disorder. Here are my works cited, my sources. Thank you.